Hey y'all, Shelley here with another tip for hospice nurses. I had a request to do a video on how I dispose of fentanyl patches out in the field. And this is a tricky answer because the FDA, their recommendation is that you take off the patch, you fold the two sticky sides together, and you flush it down the toilet. They say that the risk of exposure to a child or an animal, if it's just thrown away in the trash, is much greater than the environmental risk of flushing it down the toilet. So they feel that that is the safer way to dispose of them. Now down here where I live, a lot of people have septic tanks, septic systems. Like, I don't really know what that means, but I do know that they don't flush anything down their toilet. Like, a lot of times not even toilet paper. Like, they don't flush anything down their toilet. So they're not going to flush a fentanyl patch down the toilet. So what I do with all of my patients who are on fentanyl is I use a sharps container. Not the little bitty sharps container either, but the bigger ones that have the little flip lid. You know, you put it on there and you flip the lid and it kind of rolls it in and then it slams back shut. Those are the ones that I use. I always keep 2 of those in my car at all times. And I will take off the fentanyl patch, fold the 2 sides together, and then I pull it inside of both of my gloves, kind of like I do at the end of wound care, and put it in the sharps container. And I think that this is a pretty consistent way that's easy enough for a caregiver to do that I think they will do it. I know there are pharmacy take-back programs where they suggest you fold the 2 sides together, put it in a hard container, like some kind of plastic container, and take it to the take-back program, which is great. I don't know how many caregivers have the time or even the ability to do that. So I do the sharps container with all of my patients. Just make sure that you have at least 2 sharps containers in your car at all times. That way you can just give it to the patient at the time of the fentanyl patch. Ask your agency to order them and make it the bigger ones with the little flip lid, not the tiny ones, because it's too hard to get it down in there. I would also really love to hear what you guys do, because I'm sure that y'all have great tips on how to do this. And I think that if we can all talk about this and figure out what is a great way or the best way that works for us and share this information. So I hope this tip was helpful. And if there's anything else you would like me to talk about, please let me know. I'd love to share it here. And remember, if we work together, we can change our world.